Good morning, good afternoon. Thanks for joining us and our Virginia Roundtable series this morning. We're excited to bring two professionals from the Virginia area to speak a little bit about the dementia caregiving work in their state. And just to get us started, I'd like to say hello again and welcome. Thanks for joining us. My name is Ashley. I'm one of the coordinators at the Bold Public Health Center of Excellence on Dementia Caregiving. And before we get started today, we do like to just ground ourselves in our land acknowledgement with the reminder that the University of Minnesota Twin Cities is located on traditional, ancestral, and contemporary lands of Indigenous people. We acknowledge with gratitude the land itself and the people, and we take to heart and commit through action to learn and honor the traditional Dakota values, courage, wisdom, respect, and generosity. And one thing that we've been trying to do here is think about how we can translate these words into action and support our local Indigenous communities. So I'd like to invite you to visit and learn a little bit more about the Native American Community Development Institute at the link here or QR code. And I really encourage you to think a little bit about your own community and what organizations you might be able to approach and support as well. Thank you. So, with that being said, most of you are probably familiar with our Bold Public Health Center of Excellence on Dementia Caregiving. But for those of you who are new here or joining us for the first time, we are really designed to support state, tribal, and local public health agencies nationwide in developing various dementia caregiving focused programs and initiatives. And we do this in a number of ways, such as improving access to evidence-based programs, facilitating connections and collaboration among public health agencies and other service organizations, and also providing technical assistance for identifying, selecting, and implementing different public health interventions. And on the screen here, you will see a QR code to our technical assistance request form. We're always happy to be in touch, get connected, and maybe if you're not sure how we can support you, we can discuss that a little bit more as well. So welcome you to complete that at any time. A couple of reminders for today's roundtable session. We are set up as a meeting, so we do encourage you to please mute yourself, but please turn your video on and let our panelists see you while they're speaking. You're welcome to also change the name of your Zoom, box to include your name and maybe the organization that you're joining us with. As a reminder, please submit questions for our speakers into the Q&A feature. Sometimes that's a little bit hidden under the More button of your toolbar, so you can look for that there. And during the Q&A time, which we'll have time at the end, you're welcome to use any of those keys to raise your hand, and we can also unmute you as well. Please do use the chat throughout the presentation to share any comments, resources, and links. But again, we would like to keep the Q&A to that Q&A feature. As a reminder, we do record and share these presentations and slides as well, so you'll receive those after the event. And we would also like you to complete a survey for us once today's presentation wraps up. We really do value your feedback, and your feedback helps us shape our roundtable series, but also other presentations and webinars that we host. So we would like to start by learning a little bit more about who's joining us today in the virtual space. And if you could just, I'll launch a poll here on the screen, and if you could select the capacity that you're joining us in today, it just helps us get a better understanding of who's joining us and also helps our speakers kind of see who they're talking to. So we'll take just a moment, please. You should see a poll on your screen. Wait for just a couple more responses here. Good. So we got about 1/3 of us or so joining from a sort of community organization or service provider, about a quarter joining us, not even a quarter, about 15% joining us from our Bold public health agencies, and 10% joining us from non-Bold public health agencies. and a couple care clinical professionals as well. I'll just share those results briefly. But thank you all for joining us in whatever capacity you're here today. And you're welcome to also use that chat to introduce yourselves and connect with one another as well. All right. So, with that being said, I'm excited to introduce you to our speakers today. We have Miss Rachel Coney joining us with the Virginia Department of Health and Mr. George Worthington joining us with the Virginia Department for Aging and Rehabilitative Services. So, we'll hear from both of them today. I will let them introduce themselves in a little bit more depth. But with that being said, I'll turn it over to you, Rachel.
Alrighty, good morning. Can you see my screen okay? Okay,
Yes.
perfect. So good morning or good afternoon, everyone. Thank you so much for joining us today. Again, my name is Rachel Coney. I'm Rachel Coney Bowles, and I serve as the Brain Health Coordinator with the Virginia Department of Health. I'm very excited to be here and share some of the work happening. Uh-oh, I'm going through my slides. I'm very happy to share with you all some of the work that's going on here in Virginia to support individuals living with dementia and their caregivers, and for providers, and also the many organizations that work alongside us. So, today's presentation isn't just about our program, it's about how our partnerships and public health and community engagement come together to create systems that better support our families. So today I'd like to share with you how Virginia is approaching brain health and caregiving from a public health perspective. I'll briefly introduce the CDC's Healthy Brain Initiative and our Healthy Brain Virginia program. I'll discuss some of the challenges that have shaped our work, and then I'll spend most of the time talking about how we're supporting caregivers through education, systems level partnerships, and then I'll turn it over to our highlighted partner with the Virginia Department of Aging and Rehab Services, because again, much of this work happens through partnerships. So before I dive on in, if you could drop in the chat one word that comes to mind when you hear the word caregiving. And I can't see the chat anymore. So I'm just counting on you all to just drop in that one word that comes to mind when you think about caregiving.
I can read a couple of those off to you, Rachel, if you'd like. So, I see we have, oh man, they're coming in fast. Unrelenting, exhausting, selfless, tired, exhaustion, love, grace, confusing, challenging, complex, family, essential, a lot, support, compassion, rewarding, consuming, and patience.
Wow. Yeah, those are very on point in a lot of ways. And thank you for sharing. So, our CDC's Healthy Brain Initiative, so everything we do is grounded in this initiative. The Healthy Brain Initiative, it recognizes that brain health is is a public health issue. It's not just a healthcare issue, as you all have just stated in your comments. It provides us with the framework for helping people reduce their risk of cognitive decline, and so also improving early recognition and supporting caregivers and strengthening the systems that communities will rely on. So the HBI roadmap, it gives us those practical strategies across four key areas: building relationships, utilizing data, strengthening the workforce, and educating the public. So, at the center of all of this, you'll see is health equity. And so, this ensures that everyone has access to information and services and support, regardless of who they are or where they live. So, rather than creating entirely new systems, the Healthy Brain Initiative, it encourages us to strengthen the ones who are already serving within our communities. The Healthy Brain Virginia program, so in 2020, Virginia was selected as one of 5 states to receive enhanced funding to integrate dementia risk reduction into public health initiatives. In 2023, we received a renewed 5-year grant to expand the statewide brain health efforts. So the Healthy Brain Virginia program, this is our statewide public health response to Alzheimer's disease and related dementias. And our work, it really centers around these 6 priorities. So first, strengthening public health infrastructures. So this work becomes part of everyday public health practice rather than a standalone initiative. And then secondly, using a public health approach to address prevention, early detection, caregivers support, and community clinical linkages. And while recognizing that social determinants of health influence brain health outcomes, education also is another major focus for us. We work alongside all kinds of partners, libraries, health systems, other public health agencies, faith communities, our AAAs, and so many others to help increase awareness and bring brain health education directly into communities. And then we also supporting caregivers is completely interwoven into everything that we do because caregivers are often navigating incredibly complex situations, as many of you mentioned, with limited support. So we also focus on ensuring that equitable access and by intentionally reaching communities that have historically experienced barriers to care. And then finally, we rely on data and not simply to report outcomes, but to truly help us guide our decisions and identify needs, and then also to continuously improve how we're serving our Virginians. So true or false? Public health has an important role in supporting caregivers, not just healthcare providers. You can go ahead and drop that in the chat.
Seeing lots of true responses.
Lots of truths, and that's absolutely right. And we'll talk a little bit more about what this means. So some challenges that's driving our work. Just like many states, we've encountered a few challenges. And the first is sustainability, right? Much of this work is supported through grant funding. So we're constantly thinking about how to build programs and partnerships that can continue long after a funding cycle ends. And another challenge is reaching caregivers before they're in crisis. Oftentimes, families don't connect with services until they are already overwhelmed. And so we are working to shift that by increasing awareness early and also embedding information into places people naturally visit. And then finally, the capacity and perceived burden. So, one of the things that I found was that many organizations initially believe that integrating brain health into their work will require a significant change. But what we've learned is that with the right support and the right brain health messaging, it can often be integrated into the work that they're already doing seamlessly. So, that realization has been one of our biggest successes. And so, again, what we've learned is that success often comes from meeting partners where they are, simplifying implementation, leveraging existing infrastructure, and demonstrating that brain health can be easily integrated into work and programs that they're already doing. So, education remains one of our most effective tools for supporting caregivers. Our goal isn't, as I mentioned earlier, it's not about just programs. It's about providing information. It's about providing practical, usable resources that can truly help caregivers feel confident and connected. We offer educational sessions and printed materials, and we do webinars, and we've developed toolkits, which I'll talk a bit about, and truly creating those opportunities to connect with local organizations that can continue supporting families again, even if our funding ends, really wanting to focus on those sustainable efforts. And we also work to ensure that these materials are culturally relevant and accessible and available through our trusted community partners. And so that takes me to our Healthy Brain Virginia website. This has been completely revamped based off of conversations with community members and with partners. Initially, we found that the site was not as simple to navigate, and so folks were going there for resources, but unfortunately, we're having a challenging time being able to identify those quick resources. So a few things that we've done, you can see that we've added these different columns over here so different audiences can go and identify resources specific for their communities. And then over here, you'll see we also have this brain health events calendar. This has become uh, a true tool and resource for not only community members and caregivers, but also for health professionals. During last quarter, we had nearly 9,000 views of the community calendar. So that tells us that folks are truly utilizing this. We have information for um, uh, opportunities to increase awareness. So if there's a listening session, if there's any focus groups, if there are opportunities for caregivers to be a part of any of these educational opportunities, it's all housed in one place. And then also, a lot of times we were finding that people were asking, like, I don't know where to start. I don't know what to do after they've either received a diagnosis or they're starting to notice changes in memory. Um, they typically began to feel overwhelmed. So building this out so that families that are trying to navigate, you know, legal planning and caregiver responsibilities all at once. We wanted to make sure that we had a place that was very easy to use and practical and full of resources. So our caregiver toolkits, there's a couple of different things here. So the Virginia Dementia Roadmap, which you see here on the right, this was developed through collaboration with Department for Aging and Rehab Services and Healthy Brain Virginia and Dementia Capable Virginia. It was designed to help individuals navigate living with dementia, families that care for folks living with the disease to truly understand what to expect throughout the dementia journey and to connect them with the right resources essentially at the right time. And so it walks families through the dementia journey from early stages or early concerns through the later stages of care. And it also helps people recognize when they have become a caregiver, even if they don't identify themselves that way. It explains the caregiving responsibilities and what families can expect as needs change over time. It connects individuals with resources and respite services and care planning and palliative care and support organizations as well. The roadmap, it truly encourages planning before a crisis occurs rather than reacting during one, and that's what we see oftentimes. In addition to the roadmap, we've developed a caregiver toolkit, and so this provides practical resources caregivers can begin using immediately. So just a couple of things I'll highlight. There's communication strategies for interacting with someone living with dementia. There's tips for managing common behavioral and daily care challenges. There's information on caregiver well-being and the importance of self-care. There's also guidance on planning ahead and accessing available supports. And there's a couple of quick reference materials in there as well that's just easy to share with families. And so essentially both of these resources reflect that broader goal of building dementia capable communities by truly equipping caregivers with trusted information and connecting them to local supports early. So we're really helping improve that quality of life, not only for the person living with dementia, but also for their families and their friends who care for them every day. These resources are available on the Healthy Brain Virginia website and they can be downloaded free of charge. And please feel free to share them within your networks and for the folks that you support. The virtual dementia tour, this is a immersive, experiential training that truly helps individuals understand the physical, cognitive, and sensory challenges often experienced by someone living with dementia. And it truly provides that hands-on experience of what is needed to care for this individual and really helps guide that person-centered care. We've developed community health worker modules. So we realize that community health workers are often among the first trusted individuals that people turn to when they have questions about their health or they need help navigating services. So because of this, um, they are in a unique position, I think, to identify early concerns and provide education and connect individuals and caregivers to available resources and support. So, in order to support what they're doing, we've developed two online modules, very interactive, focused on brain health and Alzheimer's disease and dementia. And the first module introduces the fundamentals of brain health and dementia, and the second one goes a bit more in depth. It focuses on practical strategies for working with clients and for families who may be experiencing those cognitive changes. The training is available in both English and Spanish, so helping us reach a broader and a more diverse workforce across Virginia. And one of the things that we've learned is that caregivers often don't know where to begin, right? So, what knowing what services are available is extremely important. So, by equipping these community health workers with this knowledge, we're truly expanding the network of trusted professionals who can recognize those early signs that can provide accurate information and to help further reduce the stigma, but most importantly, being able to connect those caregivers with support before they actually reach a crisis. Um, and again, this is another example of our public health approach. So rather than creating a separate dementia workforce, we're really focusing on strengthening the workforce that already exists by embedding brain health into work that they're already doing. And also, I will say another thing that we've learned by doing these modules, not only are community health workers taking advantage of this, but folks from all different disciplines. We've had folks who work in activities, we've had dietary, we've had pretty much anyone interacting with people living with dementia. So it is not well, it was made for community health workers, but it's not siloed for community health workers. Anyone can benefit from this training. And while we're preparing the workforce, it's also important that we recognize that caregivers, they need that strong system behind them. And so next, I'm going to just talk a little bit about how our systems come into play. So education is so important, and that really does make an impact, but to infer that lasting change, it also requires systems level support. And so we work with our healthcare providers, we work with other agencies and emergency services, community organizations, and policymakers to build these systems that recognize and respond to the needs of both people living with dementia and for their caregivers. So by strengthening these systems, we're making it easier for caregivers to navigate and access resources and receive the support that they need throughout their caregiving journey. So some downloadable toolkits, again, you can find these toolkits on our website. This is just one example of our work. We wanted organizations to have ready-to-use resources that they could immediately integrate into their own work. So these toolkits, and you may be familiar with the early detection toolkit, it is a phenomenal toolkit. And if you have not seen it, I encourage you to either go to the Bold website and download it or go to the Healthy Brain Virginia website and download that. But we wanted these toolkits to include educational materials and screening opportunities and guidance and caregiver resources, but also referral information and practical tools that support both the healthcare professionals, but also community organizations. So really wanting to make these resources freely available to help expand our reach far beyond what I could accomplish alone. So Virginia has taken a proactive approach to policy to strengthen dementia awareness and response capacity, especially within emergency services. So in 2024, through House Bill 933, Virginia is truly ensuring that first responders are equipped to interact safely and compassionately with individuals living with ADRD. Just some key highlights from this bill. It includes fire departments, EMS, emergency medical services, and some other related agencies, but they really focus on communication. So, teaching responders how to de escalate and effectively communicate with people experiencing confusion, agitation, or any form of cognitive impairment. It also focuses on behavior management, so understanding dementia related behaviors to reduce unnecessary hospitalizations or law enforcement interventions. And then also some local resources, so ensuring responders can connect families to community supports and services. And this truly matters because oftentimes first responders may be the first point of contact during crisis involving people with dementia. So training that builds trust and it enhances safety. And furthermore, it reduces caregiver stress during those emergencies. So this initiative, it truly represents a public health and safety partnership, really bridging community services and emergency systems and dementia care by embedding dementia specific training into our emergency response systems. We're truly creating a compassionate, dementia capable workforce, one that meets residents again exactly where they are. The Virginia Memory Project. So I will say Virginia is leading nationally in building a comprehensible, sustainable data infrastructure through the Virginia Memory Project. So in 2024, House Bill 1455, this legislation formally established the Virginia Memory Project, or the VMP, at Virginia Commonwealth University as the state's epidemiological registry. Oh, I am so sorry. As the state epidemiological registry and neurodegenerative disorders. So the funding and partnerships are supported through Department for Aging and Rehab Services, or I'm sorry, the funding is supported through the Virginia Department of Health, and the purpose of this is to collect, analyze, and use data to understand dementia prevalence and identify caregiving patterns and service needs across Virginia's communities. The data, it helps to inform our policies and resource allocations and additional public health interventions statewide. The data itself, it really takes data to action. And so the VMP has shown a critical gap in respite care and support for caregivers, but has also identified some additional needs for caregivers and for persons living with dementia. And so in response, VDH and DARS, Department for Aging and Rehab Services, have used these insights to expand our programs and partnerships, directly improving care and access and support. And so this is just one example of how data is truly driving our decision making and that it truly measures the community impact. One of the areas we recognized early on was that many healthcare providers wanted to do more around dementia care, but they weren't always sure where to begin or how to create a consistent process within their practice. So, in order to address that, we developed an ADRD clinical workflow and toolkit. So, the goal here wasn't to create more work for providers, okay? It was to make dementia care easier to integrate into everyday clinical practice by providing practical, ready to use tools and workflows. So, the toolkit includes guidance on cognitive screening, assessment tools, care planning, referral pathways, and even some documentation templates, and some resources that support both the clinical team and the individual receiving care. It also emphasizes a team-based care approach. So recognizing that everyone from front desk staff to medical assistants and clinicians play an important role in supporting people living with cognitive concerns and also providing support for the caregiver. And so one of the most important components here is really helping providers make those meaningful connections to community resources. And a diagnosis is only one part of the journey, right? Families also need education and caregivers need support. And so we wanted to create a standardized workflow where we're helping providers feel more confident and recognizing the cognitive concerns and having those conversations with individuals with the disease or their caregivers. So Again, ultimately, this is about creating a more unified, dementia-capable healthcare system, one that not only improves clinical care, but also strengthens the support available to caregivers throughout their journey. And lastly, I'll just say, supporting caregivers, it does require both knowledgeable providers and strong community partnerships. So the clinical workflow, it helps strengthen what happens inside of the healthcare systems, while our partnerships ensure that families continue receiving support once they're back in community. So with that being said, we can't do this work alone. If there's one message I leave with you today is that none of this work happens in isolation. Every success we've had has been built through partnerships, whether it's healthcare systems, our AAAs, universities, libraries, nonprofits, grassroots organizations, it doesn't matter. Each partner brings their own unique expertise and their trusted relationships, which truly make our work more credible and stronger. And here's some of our listed partners here. I would just like to say, not every organization reaches families the same. They all have their different approach. And so some connect through healthcare, some connect through their faith communities or through the libraries, their veteran services, or um, even just local supports. We also work within our chronic disease unit to make sure that we are addressing comorbidities, but also bridging some of those chronic diseases to brain health to, again, have a more unified approach to increasing brain health awareness. So if you can just drop in the chat for me, where do you caregivers naturally go first when they need help in your community? So where do caregivers naturally go when they need help in your community? You can go ahead and just drop that in the chat.
I'm seeing primary care providers, senior centers, doctors, the internet,
The
social
internet.
workers, AAAs,
All
para,
great
yeah,
responses.
VA social workers, faith leaders, family. Thanks, everyone.
Thank you, everyone. Absolutely. And we work in all of those different sectors, right? Because we have to make those opportunities to connect, which brings us here. A significant part of our work is bringing people together, just like Bold Public Health Center for Excellence has brought us together here. So we work closely with memory cafes and our AAAs and libraries and our health systems and all of those previously mentioned because we want to create those opportunities for caregivers and families to access support in places that they already know and trust. And we do this by equipping organizations with support. So we provide educational materials, toolkits, trainings as well, some that I touched on and some that I didn't. But we do this so that they can incorporate them into their existing programs and services. And I always think we need to embed these because just say our funding ends, we want to make sure that these programs and resources that they don't end as well. So whether it's a library hosting a memory cafe or a area agency on aging just sharing our resources, our goal is to help them strengthen the work that they're already doing and making these resources accessible and sustainable. Okay. And we serve as a convener. So connecting organizations that may have similar goals, but they may not have previously worked together, making sure that we are bringing those organizations together, creating those opportunities to collaborate. We help build those strong referral pathways, and it also helps to reduce duplication of efforts and truly expand the reach of our services available to caregivers. And we do that through building trust. Most importantly, this work is built on relationships. We invest in time listening and understanding community needs and building those relationships with our partners, and not just our contracted partners, with our good faith partners as well. Those good faith relationships are what truly allow this work to continue beyond a single project or a funding cycle or any initiative. And that creates that lasting impact. My goal has never been simply to deliver programs. We want to help build a statewide network where brain health and dementia education and caregiver support become a part of the everyday work across Virginia. So when resources become embedded into practice, embedded into systems, trusted relationships, they will continue to grow, and organizations will begin working together and creating something much more sustainable than any one initiative could accomplish. And so that's how we help to create these lasting impact for caregivers and families and communities. And one final reflection, what's one idea from today's presentation that you will take back to your organization? Feel free to go ahead and drop that in the chat. What's one idea from today's presentation that you'll take back to your organization?
Couple responses refer to the toolkits, different aspects of sustainability, brain health seminars, that we can't do it alone and we need to partner. Bringing back just the sheer amount of collaboration that is vital to the success and support of caregivers.
Absolutely.
Thanks, Rachel.
Thank you all so very much. Here's my information if you care to connect, and I will stop sharing and I will turn it over to our highlighted partner with the Department for Aging and Rehab Services. Thank you so much.
All right. Thanks so much, Rachel. Lots of wonderful information there. I'm George Worthington. I'm the Dementia Services Director with the Department for Aging and Rehab Services here in Virginia. Our Division for Aging Services is the State Unit on Aging, and that's where our Dementia Services office sits. It's nice to see so many of our partners in Virginia on the call today. So I can get my slides to move. There we go. So I'm going to talk about a dementia capable Virginia and sort of flesh out some of what Rachel touched on. What would a fully dementia capable state look like? And this is where our dementia state plan comes into play. But here are some thoughts about what that would look like: that we would have widespread dementia and brain health awareness and understanding, timely accessibility of assessment, diagnosis, and treatment. I'm sure many of you in your states are facing long wait times for assessment at many places that can push out that diagnostic journey for even up to years. Having guides available, whether they're dementia care specialists or navigators or care coordinators or other trusted community partners like community health workers, and then to have a variety of respite options available across the state. So in Virginia, we have respite services available in certain areas that aren't available in other places, and some areas that don't have many options at all. So we're trying to improve that. And then to have a well-trained, effective, and available workforce for both in-home or long-term care. So our dementia state plan is trying to address all of these things. We do a plan that has a 4-year life cycle. So we're currently in the second year of our current plan. Halfway through, we're already starting to work on our next plan, and you can see that it's pretty comprehensive. It's got 6 goals. The most recent addition was the 6th goal, which addresses brain health and dementia risk reduction. We had some information about that in the plan previously, but with BOLD and all the new knowledge in that area, we elevated that to a separate goal. So the plan, as it was developed, we took a life course approach to thinking about people's experience of dementia from both the individual living with dementia and the caregiver side, and of course, then thinking about what services and supports are going to be necessary. So we looked at it in these four stages. So preclinical, so everybody who doesn't have symptoms. That's the bulk of the population. And here the focus is really on education. So brain health education, dementia awareness, getting a cognitive screen to give you a baseline. So if changes do happen, we have something to measure them from. And then thinking about advanced care planning. So making sure that things are put into place well in advance of any symptoms emerging. And then moving towards where symptoms emerge. Again, Rachel mentioned the question, where do I start? And that's a question that we really wrestled with. So the Dementia State Plan is developed by our Alzheimer's Disease and Related Disorders Commission. It's an advisory body to our Governor and General Assembly, and they're responsible for developing and helping promote and implement the Dementia State Plan. So where do I start? This was a question that pretty much every work group discussed. And I'll show you one of our answers to that. So Rachel showed you some of the information that we have and her website, and then we also have the Dementia Capable Virginia website. So I'll show you that in a bit. Moving to living in community, so helping support folks who are being cared for at home, which of course is the majority of people living with dementia and cognitive change. So how do we improve our person-centered home community-based services, make sure that care navigation is available to folks, that respite services are available, and also thinking about dementia-friendly communities. So this is really the focus of this conversation today. So I'm going to talk a little bit more about this area. So for person-centered home and community-based services, thinking about that full range of services. And we've recently tried to improve our education around hospice and palliative care for in-home services. As many of you know, folks living with dementia often access these services much later in the disease process than they probably could. And we want to encourage folks to think about these kinds of services earlier in their experience of the disease. Of course, thinking about the whole person, not just the dementia. So while we want to make sure that we're supporting folks with the dementia, we also want to make sure that we're supporting the person themselves. And then caregivers, of course. So through education, making support groups widely available, and then encouraging and supporting that most important caregiver self-care. So care navigation was one of those little chevrons on the previous slide. And I wanted to dive in a little deeper about our vision for this. So here in Virginia, we're pretty fortunate. We have a large number of guide providers. We've got 10 in-state guide providers, and then of course there's the national ones as well that provide services. Oh, sorry, I've been sitting here too long and my lights just went out. So we have about 10 guide providers, but we've also been funding dementia care management at the clinical level for a number of years. So we have 4 state-funded dementia care management programs that serve different areas of our state. And those programs, they started with federal grant funds and, a lot of advocacy later, and we eventually got state money for that. So we're supporting 400 families with those state-funded programs, and they provide education referrals. The care managers are integrated with the clinical care team, and and they're dementia subject matter experts, of course. And then I'm going to talk about the community care coordination last because we don't have that yet. But down at the bottom, we have community education. So thinking about who folks might interact with first. And Rachel discussed the community health worker training that we have. And we're really trying to leverage those community health workers and the promotoras to deliver or to educate folks about dementia and what cognitive change implies, to provide screening options for folks, and then to make appropriate referrals. We don't expect them to be doing that full dementia specific support, but certainly being able to have the knowledge to provide appropriate referrals. So the middle section here, community care, dementia care coordination, this is what we don't really have yet in Virginia. So many of you are probably familiar with the Dementia Care Specialist program in Wisconsin, which other states have been replicating, and we are desperately trying to do this here in Virginia too. So the Alzheimer's Disease and Related Disorders Commission, as part of its annual policy recommendations, has focused on this for a few years now, and hopefully we're going to see some action on that. But the goal here is to have at least one dementia care specialist in every area agency on aging. We have 25 in Virginia, which is quite a lot. And so we'd like to have one in every agency. They would provide caregiver education, community education, screening, and referrals. We wouldn't expect them to do case management per se, but they would be able to provide sort of short-term supports for families as they need those connections and referrals. And I had respite services as another chevron in that living in community section. And this, of course, is so important. We've been, as part of some of our other work, we're partnering with the STARS Center, which many of you are probably aware of. And we've had some lived experience panels as part of that. And so listening to the caregivers and their difficulties of finding respite, and not only finding respite opportunities, but actually finding the transportation to get there. All these barriers that still exist. So we're trying to develop services that would provide a range of respite options for folks. We do have a large number of adult day programs providing that medical support that folks need. And of course, long-term care communities offer overnight stays. But we're also trying to promote social respite programs here in Virginia. We've got a few, and it's just such a gap that needs to be filled for folks in those earlier stages of dementia who don't need that full medical model of care, but really need to maintain social engagement, interaction. And of course, dementia-friendly communities and dementia friends are also part of this education and supporting folks in their communities. And then the last bar down there is living in care setting. I'm not going to focus on that so much because that's really about the professionals, training them and supporting folks as they're in long-term care. But I did want to share our new updated website, dementiacapablevirginia.org. This is one answer to that "where do I start" question. So the QR code will take you directly to this landing page, and you'll see we have 3 buckets: seeking help for myself, a friend, or a family member, or I'm a healthcare or community services provider, or I'm a researcher and interested in learning more about research. I'm going to focus on the first bucket, given the topic that we're discussing here. And you'll see we have the roadmap highlighted here on our landing page. So that's available to download in English and Spanish, and we also have hard copies of those available to mail out. Just to show you a little bit more of the roadmap, but as Rachel mentioned, it goes stage by stage through the disease process, starting with wondering and worried, all the way through late stage dementia. We adapted this from Washington State's dementia roadmap, with great gratitude to them for what they developed. We added a couple of sections around caregiver self-care and hospice and palliative care more recently. All the art in the roadmap is created through the Opening Minds Through Art program, so an evidence-based program for folks living with dementia. Wanted to highlight that it's possible to have a good quality of life with dementia. And just a couple of pages from the website. So when you click through to the individuals and families section, you'll have several tiles. This is the What is Dementia tile. So we wanted to provide education as well as links to quality resources. And you can see another, the fact sheets that Rachel's team developed, the 10 warning signs of Alzheimer's that folks can download. This shows you our basic navigation. I'm going to go to the caring for a loved one since we're focused on caregivers today. But you can see that for providers and researchers, we have quite a bit of information as well. Researchers connecting them to data sources and grants, providers, education and training, and best practices. And then we also have referral and care coordination tools for them. So when you land on caring for a loved one, again, Rachel mentioned about how helping people understand their role and helping people identify as a care partner or caregiver, and then thinking about what might be needed then, building a care team, caring for yourself, advanced planning, and then a bunch of helpful resources, which I couldn't show all of them, but I'm going to show you the link that for caregiver education and training, since this is such a vital area. So we have links to a large number of virtual trainings that caregivers can access for free. I'll just highlight, actually I'm not because they're on the provider page, but on the provider page, we have a wonderful program that's been developed here at Virginia Commonwealth University on deepening your person-centered dementia care, aimed at long-term care partners, but really very useful for family caregivers as well as other community providers. So that is on the training under the provider bucket. And that's all I have. I want to leave some time for questions. There's my contact details and websites. So thank you.
Great. Thank you, George. Thank you, Rachel, for all of this information. It really is amazing to see how much there is available in Virginia. I think that that's really what stood out to me, is just this rounded approach of person-centered or support, whether that's, with the CHW trainings, looking at the first responder trainings, the clinical workflow toolkit that has been mentioned. So we do have lots of good questions and comments. Thanks, Rachel, for responding to a couple of those in the chat. And I'm just kind of going to go ahead and start reading through some of those, but feel free to jump in, Elma or George or Rachel as well, if you see any specifically that you'd like to address. But in these resources and supports that you've mentioned, one of our attendees is wondering, how do you educate about the end-of-life care choices, resources, and support? Are those, included in some of those toolkits mentioned, or some of those websites as well?
Yeah, so I'll start, and I think George, I'll let you finish it off. But absolutely, the dementia roadmap that George was just showing you, there are components in there, and there's also some additional resources that talks about that care planning piece in the back. And then on the Healthy Brain Virginia website, we have an entire section dedicated to that end of life care planning and what that could essentially look like for folks. Within our caregiver toolkits, we also have it's not an in-depth it's not in depth at all, but there is some information there that will connect them to resources around end of life and hospice and any of those palliative care supports.
Yeah, and so as Rachel said, in the roadmap, we have a whole section now devoted to hospice and palliative care. And then information about, we have the wonderful NADRC advanced planning kits available on our website to download. But I love that this question came up because this is something that we're thinking about. I've been talking to end-of-life doulas recently about how we could utilize their services in dementia care more broadly, not just at end of life, but maybe earlier in the journey as well. And so if anybody has interesting experiences or ideas about working with doulas and dementia, I'd love to learn more as we try and bring this to Virginia.
Thank you. And another follow-up question, and I saw this on one of your last slides, George, but related to advanced care planning. Are you aware if there's direct or dementia directives included as part of that?
Yeah, so there are a number of dementia-specific advanced care directives out there. We have included links to a couple of them on the Dementia Capable Virginia website, while encouraging folks to do that in partnership, in tandem with a Virginia state advance directive, just to make sure that all their bases are covered.
Thank you. I want to touch on the first responder training that you talked about, Rachel. I think that was one thing that I found really interesting. And I see a question here from one of our attendees, and it was a question that I also had is when requiring training for the first responders, where exactly are these trainings coming from? Are they using existing trainings? Are they trainings that, your team or someone related has developed? And maybe if you know anything more about, if these are in person or online, things like that.
Yes. So actually, George does these trainings for the workforce. We Healthy Brain Virginia, we NVDH, we just supported the passing of legislation, which was truly impactful. These are done in person. They are not virtual. And we also work with the Alzheimer's Association, who provides a very similar workforce readiness first responders training.
Yeah, I'll just add to that if I may. So yeah, there's kind of a mix of the first responder trainings. So we didn't, while the state mandated that first responders have this training in different dementias, including dispatchers, which is great, they didn't fund it. So most of it is being implemented at the academy level. So as new folks come on board, they're receiving that dementia education through the academies. There are some partners. I'm going to give a shout out to Virginia Commonwealth University again, which has been partnering with a number of organizations across the state, a number of EMS providers to do in-depth in-person trainings. So I was part of one in rural Southwest Virginia last week. We had a pharmacist, dementia expert, a few other folks. I was talking about resources for the responders and caregivers. So really comprehensive training, but unfortunately we don't have the resources to do that everywhere, but we're trying to cover as many bases as we can.
Sure. And Rachel, you had mentioned that there are some trainings also maybe broadly available through the Alzheimer's Association. One of the questions that also followed up was, what are some resources for states who are looking to train their first responders? So, I mean, that might be a place to start. Are there any other recommendations?
Yeah, definitely start there. But also, I've done a lot with community service boards who are providing education for first responders and our police officers. And so, connecting with your community service boards because they may already be doing this same thing. They may already be embedding this type of training and education. So, I would definitely start with those two.
Yeah, and the International Association of Chiefs of Police is a great resource as well. So we have links to them on the website as well.
Thank you. I know we are actually already at time here. Elma, you had one remaining question. Did you want to just ask that quick regarding community health workers? And when you speak about community health workers, do you mind just providing an example of what that is?
Mm-hmm. Yeah, I was very curious, Rachel, about just going back to the community health worker training. And I know in Virginia, you collaborate, you engage with the guide assistants implementing the CMS guide model. And I wonder if you're aware to what degree CHWs, community health workers, are integrated in the care coordination within the community. What are some challenges, opportunities you're encountering? Yeah.
With With the guide specifically. So the community health worker training, this was developed for all community health workers, so not necessarily attached to the guide. Now, I will say we have two guide partners that we work with, and we utilize that through the referral system. So when they need that additional support for caregivers or that person living with the disease, we often will refer them to VACHA is the acronym. It's Virginia Association for Community Health Worker. If they have a community health worker within that region, then they will push that referral through.
Mhm.
Okay. Well, that
Thank
does
you.
bring us to our time today. I know that there's some questions that we didn't get to. We'll pull some of these together along with the resources that have all been shared and discussed today and include those in our follow-up email. But thank you all for taking the time to join us today. George and Rachel, thank you so much for all of the information that has been provided. Super helpful to see this work in real time and real life examples. So as always, thank you. Don't hesitate to reach out to Elma or I or anyone else at the Bold Public Health Center of Excellence on Dementia Caregiving. And with that being said, have a great rest of your day. Thanks, everyone.
Thank you, everyone. Thank you, Rachel. Thank you, George.
Thank you. Bye-bye.
It's been great to have you.